Coming up on today's show, we are dedicating the hour to those enjoying the golden years of life.
That's right. We have everything for ways to feel better and live easier with some great resources.
New Day Cleveland's Senior Show, brought to you by Mutzko Insurance, starts right now.
Well, Laura, it's nice to meet you. And
When
I came to the door, I saw Laura Mutzko on the door out there. And how long ago did this business start for you?
We started it in 2006. I started it in 2006.
So it's your business?
Yep.
Yeah. So when you started in 2006, how are things different then than they are now?
Well, then there was 10,000 people every day turning 65. Now there's 12,000 people turning 65, and it's just getting busier and busier and busier.
So there's a lot of challenges out there. And what I've sort of discovered over the years of talking about Medicare and folks' retirement and that sort of thing, the rules seem to change all the time. It's like what you knew when you started is not what you do today.
Exactly. That's why we get tested every year. We have Medicare tests us, and we also get tested on every carrier that we represent, because those rules change every year. They're very strict on that. Understanding it in your mind and then being able to explain it to the seniors is very difficult, because it changes depending on how the carrier is representing their tiers and the deductibles and things like that. So being able to adapt to which carrier is doing what and explaining it, that's challenging. Yeah.
When I hear you speak about that, I think a little bit of like a tailor when you go to buy a suit. Like everybody needs a suit, right?
Yeah.
But they all wear different sizes and different shapes and that sort of thing.
Exactly.
So, you're not only just telling them about the changes in the way Medicare is administered, you also have to, how it plays to them, what their needs are. So what are some of the different needs that you recognize?
Well, a lot of it has to do with the medications that they're taking and the doctors that they're seeing and where they're living, because some plans are limited by the counties that they're in, and it's really in their needs.
Yeah.
So
if you're more interested in eye care or dental care, is that like two different things? Or if you're more interested in how often you see a doctor for blood work or something like that, is it all different for different people?
Yes, it is. It's not one size fits all at all. It's very, very individual.
So when you started this business, did you realize in the beginning, like you started a business because you want to have a great business, but in the end you're really like helping people? Do you ever feel like that?
Oh, absolutely. I love my clientele. They are just such a wonderful group of people, and it's like everybody's grandma, and grandpa. It's so different than commercial business, because you're dealing with people one-on-one, and it's very rewarding.
Yeah, so when you see Mutzko Insurance on the door, like I just walked in through the door, you're really walking into a group of people who are like, they're about to become your friend.
Yeah, oh, absolutely.
And an advocate also, is that right?
Absolutely. We do as much as we can for our policyholders. We handle all their billing problems, claim problems, coverage problems. We pretty much take care of them as much as we can for as long as they're with us. And yep.
It's like having a friend.
Yep, it is.
Mutzko Insurance, thank you very much. Had a great career, and it's going to keep on going.
I hope so.
As long as they keep changing that Medicare stuff around. Right?
Yeah, exactly.
And we've got to tell them how much it costs. How much does all this cost?
Nothing. We get paid by the carriers. We do not get paid by anybody. The only thing we will take is cookies. And we do have one of my policyholders makes wine. So when he has a new kind of wine he comes out, he brings us a bottle. And we all taste it for him.
It's free and love.
Yep.
Thank you very much. So nice to see you.
Serving delicious meals to those who need it most. We are here at Global Meals in Bedford Heights. I have Natalia with me. How long have you had this business?
We've been doing this since 2006.
And you are serving meals to senior citizens throughout the state?
Yes, throughout the state in all 88 counties and parts of Indiana. And we serve to seniors and adults with disabilities.
That's incredible. Now, when you started, how many clients did you have? How many families or individuals were you giving meals
We
to?
had 16 people on our first route.
16, just a little over a dozen.
yes.
And now how many do you service?
We service over 20,000 consumers.
Okay, so what types of meals do you provide?
We offer anything from comfort meals, gourmet meals, vegetarian, gluten restricted. We have kosher meals. We have Eastern European meals.
That's a long list.
Yeah, it is.
Look, now I see that there are these lovely ladies working hard behind us. What are they preparing for?
They're packing our Eastern European meals for consumers that we have around 2,000 of them.
How many meals are people getting every week?
It's based on the program that they're on and how many meals they're authorized to get. So we deliver anywhere from 10 to 14 meals weekly or bi-weekly. All of our meals are frozen or refrigerated. So when we deliver to them once a week, they can just open, warm it up, and eat it.
Makes it very simple then,
Yes.
too, for everybody. Now, who qualifies to be able to get these meals?
The programs we work in contracted with are Medicaid waiver and local city levy programs, including DODD. It's Medicaid funded programs.
So it's no cost to as long as you're part of one of these programs, it's no cost to you as the consumer that would.
Yes,
would
yes.
then
The
get
program
food.
pays for the meals.
I can only imagine how beneficial. I mean, you see this. Your company has seen this for years now. How beneficial this is to individuals who
Absolutely.
otherwise wouldn't have it.
Yes, our goal is to provide healthy and delicious meals and to keep them more independent and stay in their homes instead of going to a nursing home, and keep them outside of the hospital by providing.
And I'm sure that then, in that sense, you're helping with people. It provides for them in a variety of people who are hospitalized, who may be going through illnesses, disease, things like that. I mean, this is all areas in which you can help them. Now, I noticed you have the frozen meals ready to go, but then there are other things like milk and
Yes.
juice. How does that work? And what part of the process is that involved?
So we, besides the boxes that you see around, each box has about it has 7 meals in, a bread and a butter, and then consumer has a choice to choose what kind of milk they want, what kind of juice they want, or what kind of side vegetable fruit that they would like to receive with their meals.
If someone's watching right now and they think, how can I be part of this?
Yes.
They would have to either contact Medicaid.
Medicaid waiver program or area agency on aging. Also could be managed care companies like Buckeye, United, CareSource, Molina, Aetna, or if they're on DODD, developmental disabilities, they will contact their case worker or case manager and request or see if they're qualified for home delivered meals.
I can only imagine how much this means to so many people. Again, you're servicing all over the state. Thank you so much for giving me more of an inside look at what you do here.
Thank you.
I appreciate
Thank
it,
you.
Natalia.
Thank you.
Still to come on our senior show, a healthcare experience designed specifically for older adults.
Every day is a new day. Follow New Day Cleveland on Facebook and Instagram.
Hearing loss can be a common thing as we age, and if it's not addressed early on, it could lead to more serious issues. Well, the team at Modern Hearing Solutions is ready to help with that.
There are 60 million Americans with untreated hearing loss or tinnitus in America. Most people will have a hearing loss for 7 to 10 years before they actually do something about it. For most people, hearing loss happens very slowly over time. It's very insidious, so they don't realize how much hearing they've lost. But their family has been living with it for that 7 to 10 years, and quite frankly, they're ready to have their hearing treated. Normally, the first signs of hearing loss are denial. People don't want to admit they have a hearing loss. They just don't. Years ago, a manufacturer did a study, why do people not treat their hearing loss? And most people think it's because of the financial portion. It's not. They don't want to admit they have some sort of flaw, that something's wrong with them. And that's normal, we're all like that. But again, early signs, it's usually denial. Your family, friends, neighbors, business associates, they all know you have a hearing loss. They can tell you can't hear them very well. But I hear it all the time. I hear what I want to, my hearing's not that bad, maybe it's just wax. But again, it's just denial. Eventually they come around to, okay, so my question to my patients is, okay, you seem like you think your hearing's not that bad, so ask yourself these questions. Am I really hearing the TV as well as I used to? Am I really hearing at work and office meetings in church as well as I used to? If you can honestly say, no, I'm not, then again, you probably have at least a mild hearing loss. And a mild hearing loss is a severe problem. You will have a lot of difficulties hearing and understanding in the presence of background noise. Sometimes people will say they feel like they have water in their ear, they feel a little bit plugged up or occluded. That's usually a sign of a hearing loss. We know now that we're not just treating the ear, we're treating the brain. When somebody has hearing loss, it's not an ear issue, it's a brain issue. The information's not getting to the brain to be processed properly. By treating your hearing loss, you'll reduce your risk of falls by 3 times, reduce your cognitive overload. About 15 years ago, the first study came out connecting untreated hearing loss to cognitive issues. We know now that, again, we hear with our ears, understand with our brain. So when the brain is working very hard to process sounds, the brain goes under what's called a cognitive load, and it creates a lot of stress on the brain. And we know now that untreated hearing loss, even a mild untreated hearing loss, your risk factor of dementia goes up 200%. A severe untreated hearing loss, your risk factor goes up 500%. You're also 3 times as likely to have balance disorders, falling issues, and memory loss as well. That is a lot of stress on the brain when the brain has to go into this cognitive overload. And we know now that when the brain's under load, it actually starts to take from other areas of the brain, especially the visual portion of the brain, looking to fill in the information. My number one saying is, it's not about the widget. It's just not. A lot of people focus on the widget. We're about treating hearing loss. And I could have some very good outcomes using many different brands and products out there. But again, it really comes down to the professional, how they listen to you, how they interpret what your problems are in resolving that issue. Modern Hearing, we have 6 locations throughout Northeast Ohio to serve you, and it's an amazing award-winning team of audiologists and care providers. We focus on you, the patient, what your concerns are, and we're not here to sell you widgets, we're here to treat your hearing loss. And you can only achieve that by gaining as much information about the patient and what their needs are and what their struggles have been. And again, we're here to make hearing easy and resolve issues.
Modern Hearing Solutions has multiple locations. You can go online to find an office nearest you and to book your appointment.
Boy, it's great to meet you. I saw the sign outside, it said Spry Senior, and I was thinking, I'm a senior, I should be a little more spry. How could you help me be that person?
So Spry Senior, we're a primary care practice for older adults, doctor's office, and we can help you with that by not only providing the best experience in your health care, but also providing things like fitness and health education and social events as well.
What are some of the examples of what you can do other than introduce me to the doctor?
Well, start out with first our ease of access, which is important. So you saw when you came in, you park your car, you walk right in, there's no steps, no elevators, no parking garages. We make it very easy for our patients. Other things that are convenient, we have an on-site lab, and then we also provide some of the additional things like care coordination for our patients. So we make it easy. We set out to make it an easy experience for them.
How about consultation in terms of remaining healthy healthy and to get more healthy?
So we have a great health and wellness coordinator here. She does great health education classes. She teaches people with diabetes and other health conditions how to actively self-manage those. So she works hand in hand with the providers and with the patients to give them the tools they need.
What are some of the results you see from people? They come here a first time, second time, third time. Do you see them pick up?
We do, because not only do we have great providers here that take good care of them, but again, we offer health classes here. Silver Sneakers is a best benefit from some of their Medicare Advantage plans. So we offer things like cardio drumming and chair yoga and line dancing. So again, our goal is really about treating the whole person, not only from their primary care experience, but again, keeping them healthy through fitness and health education, and then great social things. A lot of camaraderie among them and their friends, and they meet new people, and it's fun for them to come.
And I bet it's really sort of a calming, wonderful thing to have like a doctor that specializes in helping a person stay spry as a senior.
They do, and they're great. Our providers are excellent. Our patients love them. And what's really great about our patients is when they are here doing some of the other things, they can see their physician right there on site as well if it's their appointment day. So they do get to stay in touch with them and see them a little bit more frequently.
Well, I'm going to go see the doctor.
All right. Good luck.
Well, it was very easy for me to find Dr. Rosenberg right here in the Spry Senior Clinic. And what makes this clinic different and special?
Well, at Spry, we cater to older patients. They have unique problems, new problems to them. They require more time and more attention, and that's what we strive to give them.
I see we have a whole bunch of exam rooms here. Let's check this out. So this is where the patients come. And what age are your parents? What are your patients?
58 and older. Some are just turning 58. Some of them are much older, and we try to cater to everybody.
I'm much older than 58, so I know there are always like new problems and new things you have to deal with, and you really have to communicate with the doctor more often, don't you think, as you get older?
Yeah, that's one of the things that we do differently here at Spry, is that we allow for more time. We have longer appointment times and better access as well, because sometimes even one appointment isn't enough to really get to the bottom. We like to have a more personal relationship with our patients, and you can't do that if you're seeing patients quickly, and so many patients in one day. Many of our patients have chronic illnesses, blood pressure, diabetes, and whatnot. And that requires a lot of time, not just for the patient managing it at home, but also here in the visit. And so by having more time, per appointment, or sometimes more appointments, available to the patient, we can start talking about some of the other things as well, whether it's mobility issues, memory problems, just things that, depression is a very common problem amongst the elderly, and social isolation. And we try to manage or, positively affect all of those issues.
As a physician, I bet it gets easier to recognize the problems of an older person the more older people you see, too. I mean, if you're treating a kid that was like 12 years old, it's like turning a lot of pages in between those two patients.
Oh, definitely. And, I've been in the business now for over 30 years, and so, over time, my focus has sort of evolved into care of the older patients. Some of my patients have sort of aged with me into our program.
And I'm sure it makes them feel more confident. And when you call the doctor, you can get a hold of the doctor, which is not an easy thing to do all the time.
Yeah, well, that's something that is particularly important for me as a provider, is that I almost, I don't want my patients, talking to somebody else. I want to be the one to help them.
Take care of them.
I take pride in that, and and I like having that personal relationship with the patient. It allows us to talk about anything while we're in this room, and most of the time we get a good laugh. We learn about each other sometimes.
Well, I'm looking forward to becoming a Spry Senior.
Well, we'll just, I was going to say,
okay,
we're getting started right away.
Okay,
so.
Thank you very much. When we return, Bathroom Designs helping seniors gain and maintain their independence. Well, I'm here with Rob at JR Bath in Canton, and your company, you do baths all over Northeast Ohio, right?
We do, absolutely.
So I look at this bathtub and I go, wow, Kim, I saw this beautiful bathtub. I'd love to have that bathtub. And Kim would say to me, David, you probably fall down getting in and out of it. You get that a lot from people?
We do, yep. And I'll tell you, when you have a tub like that, it's a little hard to get in and out of. You may want something a little more like this.
Okay, like this tub here.
This tub here is great for a little bit lower of a level, but
I have a tub like this at home, and I tell you, I'm a little leery about when I go to step in it. Like I've got it 1 foot, 2 feet, slippery.
I understand.
So,
and you want to go to the next level.
So what's the next level?
Let's show you another option here. So what we do a lot of is we convert bathtubs to showers.
So the bathtub, I could have my same room, my same everything. You take the bathtub out.
It is in the exact same footprint of your tub now. You can have a barrier that goes all the way down, a barrier free, up to so many inches, whatever works best for you.
And what do you do about like shower doors on this or curtain?
You can do a shower door, you can do a shower curtain. Again, everything is a personal preference when it comes to something like this.
Yeah, like that. Easy to clean?
Very easy to clean. Non-porous product, infused with microban, prevents mildew or mold from ever growing.
I like that. Now look, I look over here, I see you got a bunch of them here.
We have a bunch.
So JR Bath's the right place.
Absolutely.
So this is pretty cool. So you could, the same thing, you could take my tub out and you could put this in
Tub
my
out,
house.
shower in. What's nice about this, you've got a barn style door here which rolls back and forth on the top as
like
opposed
that.
to something on the bottom.
Yeah.
So you never have track to clean. You can do a beautiful seat that's either stationary or fold up.
You said the right word, seat.
Seat.
So there's a beautiful place where you could sit. When you sit in the shower, like sometimes you bend over, you're trying to clean your feet or whatever you're doing.
Sometimes you just need to sit down in the shower. It doesn't always help to always stand.
And that's one of the things you like about a bath. A bathtub, you can sit down in that bathtub and you can relax. So now, rather than just take a shower and jump out, you can sit in the shower and relax.
Absolutely.
I saw something on television one time where you jump into it and the door and it's like a tub and a shower.
Well, absolutely. Talking about sitting in the tub, let's look at this.
So same way, I've got a tub, I got shower rods, I got all this crazy stuff in the walls. You can come in and replace all that with this.
Correct. And what's nice with this, you can have a heated seat, you can have heated jets, you can have water jets, you can have aromatherapy. Whatever you need.
How does that door work?
Well, let's show you. Just come on over. Just swings in. It's got a watertight seal on it, so you never have to worry about the water coming out.
So you don't fill it up first and then open the door.
No, that would probably not be a good idea.
A bad idea. And what do these buttons do again?
Those are all for the different kind of jets that you can have. A lot of different jets on these things.
Okay.
So if you have pain in your legs, your sides, your hips, wherever you are, that's where we can get the jets put in to help you with that therapy.
So this can give you the same feel as a bathtub, but it's a shower, and the same, you can walk right into it.
Correct, yes.
How about you get really simple jobs like where somebody says they just want a seat, you have different kinds of seats you can use?
We do. You can either do a stationary seat like we saw in the last one, or you can actually do a fold-up seat, which is a teakwood seat.
Okay. And how about colors? Things come in different colors because I know people about
There
decorating and all
are
that.
150 different colors and designs to choose from.
Okay, so when you do a job like this, how does it work? You come out, and what's it like?
The process is pretty easy. We come out, we do measurements, we go over those different colors, different designs, different fixtures with you to see what you like, and then we put you together a free estimate based on what you pick out.
And how about financing?
We handle financing as well. We have a bunch of different finance options that we can help with.
I'll tell you what, I would like to do something because I got to get out of the tub and into the shower, but picking the right shower, you can help me with that.
Absolutely. We've been doing that for 48 years here in Ohio.
JR Bath, thank you.
JR Bath.
Nice to see you.
You as well.
After the break, the facility offering easy living for seniors. One of the many tools that we have here at our fingertips to utilize in Northeast Ohio for senior citizens and aging adults is the Visiting Nurse Association. And I have Marilyn Cully joining me this morning. Thank you for having us.
Thank you.
I think it's so important for people to know overall the umbrella of what all you offer here.
Sure. So the Visiting Nurses Association of Ohio has been around for over 120 years, which speaks to a volume of what we do here in the community. But we provide what is called skilled home health care. We also provide hospice and palliative care. We provide behavioral health care, which I am involved with, as well as home care, which is private duty.
And so now you are a psychiatric nurse practitioner.
Yes,
involved
I am.
in the behavioral health care, which I find to be something that is rare with a home health service.
Sure. So VNA has had the behavioral health program for quite some time. And as we know, there is a growing need for mental health care in general in the population. 1 in 3 women, 1 in 5 men have mental health disorders. I would say what's unique is, once again, that we go to the individual's home. When you're in a hospital setting or in an outpatient setting, you never get the complete picture of what is occurring in that home. In other words, how it impacts the family.
So true.
How it impacts, the individual patient, in the sense that we don't know what they're lacking in their home, what social issues are also contrived to exacerbate their illness.
I think about the sometimes stigma that comes along with behavioral health.
Yes.
And how it affects seniors. Does it prevent or put up barriers almost for them to get the treatment that you provide?
Unfortunately, this population, usually their lifespan is cut short from 10 to 25 years. And a lot of it is related to the illness and the way their lifestyle is. A lot of them often smoke. A lot of the medications cause them to have what we call the metabolic syndrome, so they have diabetes, heart disease. So there's many different areas in their lives that are impacted by this illness. So we're treating that whole patient, and that really is the beauty of what I see in our program.
Well, when you look at the other branches that are involved with VNA, hospice care is one of them. And Dr. Marian Haller, you see patients throughout Northeast Ohio on a very regular basis. So I would love to ask you, I feel like there often are misconceptions or myths that come along with hospice care.
You're so right. So one of the biggest things is people think of hospice in the last 6 minutes or the last 6 days of life, and it's really a robust benefit from insurance companies and Medicare and the government to care for people that are facing maybe the last 6 months of their life. And it can care for the patient, the family, with a whole host of services, equipment that comes into the house, medications. So I think the biggest myth is that people are so afraid to talk about it and access this care.
What do you think makes Visiting Nurse Association hospice unique and different from others that are out there?
I think first is the staff that we have. They're dedicated to the patient care, and they want to put the patient and the family first in everything they do. We've been around 120 years caring for patients in the community, at their most difficult times, whether it's the nurse, the home health aide, spiritual support, social work support. It's like one-stop shopping. And I think as a not-for-profit agency, everything we do is for the best interest of the patient and the family when they need care.
Thank you so much for having us here, and we're
Thank
learning
you so much.
so much about your wonderful organization.
Yeah, it's an important topic, and we need to learn to normalize the conversation about end-of-life care here.
I would agree very much. Thank you.
So when I came on campus here, life enriching communities. So Concord Reserve is part of that.
Yes.
Tell me a little bit about it, about this whole beautiful area.
So you're right. Concord Reserve is part of Life Enriching Communities, and we operate 6 life plan communities throughout the state of Ohio, with Concord being one of them. And we have 3 in Columbus, and then 2 of our communities are in Cincinnati.
It's interesting too when you see some of the folks. I mean, is it divided up into different communities for different purposes?
Here on campus, we have different levels of care depending on what your needs are. So we have independent living, assisted living, memory support, and then skilled nursing and long-term care.
And she told me right away, independent living is sold out. Like she thought I was coming in, I was going to move in, but she said, you're going to have to wait because we're going to have to expand.
There's been a tremendous amount of interest in our community, and that is the reason that we're getting ready to start a major expansion for independent living.
Yeah, so why do I see all the smiles? What's going on here that's so much fun and makes it so great to live here?
You know, our residents are so lucky. They enjoy a really robust programming and opportunities for them to be actively engaged in their life. And studies show that purpose and engagement in your own life is one of the leading predictors of having a healthy lifestyle and longevity. And so that's really what we focus on, is giving our residents the opportunity to be engaged and to have exceptional everyday experiences no matter what they're doing.
Yeah, it seems to me too. I've had a few people coming to visit folks too. It's like their lifestyle has not really changed at all. I mean, it's like come and go. I'm going to lunch with my girlfriend. I'm doing this. We're going to have lunch over here. We're going to walk around outside.
Yeah, most will say their lifestyle improved because they don't have to tend to their house. They don't have to worry about their gutters and do all of the tasks that us homeowners have to do. They just get to do the fun stuff.
So what are you most proud of this group of the folks who run this?
I think that our associates are something to be very proud of. I was meeting with some residents yesterday, and they're always so complimentary of our associates, but they said, not only do I know that they care about me, but they know how to care about me. And so that's one of the things that we really get to do, is learn all of our residents as individuals and find the ways that we can enhance their lives in a way that's meaningful to them.
On our show, it's always about the food. Everybody wants to talk about the food. How about your show here?
Food is a
It's a big deal?
It's a big deal, yes.
It's a big deal. So what do you have, a chef, and how do you know about the diets and all that sort of stuff?
We do. We have an executive chef in our independent living section, and as well as on our licensed side of our community. And we talk to the residents, we find out what types of things that they like, and we incorporate those into our menus. We have daily specials, and the food is delicious. Oftentimes when I'm in town, I choose to eat here because I know I'm not going to get a better meal at a restaurant nearby.
Right. I was talking to somebody, and they were talking about lunch. I said, talking about lunch, and everyone, well, what are we going to have for dinner? I mean, it's like it's the star of the show.
It is, and it's interesting to see the changes in our residents' dietary preferences. We're having residents looking for gluten-free or vegetarian options, and that's one of the things that we're very proud of, is that our chefs find ways to make that available to our residents.
So I bet a lot of folks, when they come here, they expect to have a good time and be comfortable and all that, but I imagine they end up being healthier being here with all the activities, and you say, dietitian thinking and that sort of thing.
Yes, our programming, we call it Our Way of Wellness, is focused on 6 major domains of health. So that's physical health, emotional, spiritual, occupational, intellectual, and by focusing on all of those domains, it's a really holistic approach. And what studies show is that when you do have that holistic approach, that you see benefits in your health. So you are slowing down cognitive decline. There's a lower risk of developing dementia or other chronic medical conditions.
And you live longer.
And you live longer and happier.
Talk about enriching. Thank you very much, Paul.
Thank you.
It was great. Still to come, more questions getting answered when it comes to Medicare.
David and I want to thank Dillard's Beechwood for helping us to look our best every day on New Day Cleveland. Did you know the Eastside location is Dillard's Midwest flagship store? They carry hard-to-find designer brands in fashion, footwear, home goods, and beyond. Not to mention, you can shop with a personal stylist at no cost. If you like our style, check out Dillard's Beechwood.
I get to meet a health insurance broker today. Shireen, how are you?
Good, how are you doing today?
So how long have you been with Mutzko here?
I've been here for about 7 years now.
So how would you describe your career? I mean, I know it's probably rewarding and all that sort of thing, but it's important too, isn't it?
Extremely important. I definitely feel like I'm helping people every single day I come into this office.
So what's it like? Somebody calls, and what's that call start like, and what kind of things do you go through with each person?
So really getting the context from the individual, how old they are, when they might need their insurance to start, when their current insurance, health insurance might be ending. You know, there are lifestyle choices, doctors, medications. There's a lot of variables that go into that phone call.
So, like, what kind of insurance? What is out there? Like, I'm not quite old enough to be there yet to understand. And I understand things change every year, so you have to talk to Shireen and find out what changes and how you make it tailor fit to you.
Correct. So specifically this year we have open enrollment, which is October through December, and that's mainly for people who are 65 years and older to join, drop, or switch their health insurance policies.
So why would you drop?
Depending on your situation, you might need to or want to. So say you were going back into the workforce, you were getting onto an employer insurance policy, you might want to drop your health insurance coverage through Medicare. So that's a perfect example of wanting to drop.
And then there's the word change in there, so things don't stay the same. Like, if you signed up for something last year and you thought, like, I've got it all together.
Everything changes every year.
Every year?
Yes.
Like for example?
The medications, the formularies, the doctors, the tiers. Yeah. I mean, I could go on and on and on.
Yeah.
And the carriers themselves change as well. So based on the formularies, they could join, drop medications on their formularies. So just a lot.
And you said you can go on and on and on and on. And
yes.
The further you go on and on and on and on, does that mean it costs more money or the bill gets bigger?
With regards to what? Us?
Well, yeah.
No, absolutely not. With regards to the carriers, possibly, but when you come to us, we do not charge anything.
You don't charge anything?
Free consultation across the board.
So you were talking about, it sounds like it's a big process to discover all the different things that go on, how your customers' health may change or what their needs are.
Very much so.
And you do all this and you don't charge them anything
Correct.
for that?
Yes, 100%.
What's it like when you get to know these folks? Like maybe you're newer in the business, you're a younger person, so you dealt with some people last year or the year before, and now you get to meet them this year. What's it like to get back together with them?
I love it. It just makes me smile. I mean, I've developed relationships with 72-year-olds that I never thought I'd ever do in my entire life.
Yeah.
It's just extremely rewarding, and it's just incredible.
Yeah.
It's so awesome to see the changes that you could make for somebody who just simply couldn't afford a prescription, and you're just helping them through that.
Yeah, I mean, you're like a bearer of good news to people. I mean, like
for
you
the
said,
most part, I'd like to think so.
Yeah, I mean, like you see a little hole in their coverage and say, like, well, maybe if you drop this,
Correct.
Change to that,
or we can go through this route for something. Yes.
Mm-hmm. So would you say it's like cooking up an individual recipe for every customer that you run into, and you started scratch? You're cooking from scratch.
Correct. Yeah. No, I absolutely love that. That's a great metaphor.
Let's Go Insurance.
Yes.
Yeah. Thank you very much.
Come see us.
They are dedicated to keeping you rolling even if you're faced with certain health challenges. And here at Rocking Mobility, they're also determined to help you figure out the best solution to have the best quality of life. I'm here with Marcia Adair. She's one of the owners. Thanks for welcoming us today.
Thank you for coming in.
So for people who aren't familiar, at Rocking Mobility, you are all about helping people who are faced with certain mobility challenges figure out how to enjoy life as best as possible.
Correct. So we get people from all walks of life coming in to figure out how to go out and see their grandson's soccer game if they want, or if they just have had surgery and need to be able to get around their house or sleep at night after surgery.
So you're helping people with a wide variety of different ailments. Is there a common mobility issue that you frequently see, or does it really just kind of vary?
Definitely varies. We see anyone from needing equipment because they have arthritis and they just can't get around much anymore, to someone even yesterday, she has MS and needed a wheelchair that was narrow enough to fit through her narrow doorways, which we see a lot of here in Cleveland.
And I think it's worth noting too, this is a small family-owned business. You're right here on Lorraine in Cleveland, and you have this beautiful showroom. Nowadays, people like to buy things online, but there's something about being able to actually talk one-on-one with someone like you to help navigate the process. When people are coming in, do you find that they're often intimidated, especially people who are coming here for the first time?
Yes, we see that, and we see part of our job, if you will, is to educate people, because there is a wide variety, if you look around, of equipment. So even if it's a four-wheel scooter, they have different things that they could bring to that person's ability to get out and about.
I want to take a look over in that area because I'm seeing things that I didn't even know existed, which I think is actually really cool. So on this other side, there are these beautiful recliners, but these are very special.
They are reclining lift chairs, so not only will they recline you back, some of them can even get your feet up over your head. So if you have swelling in your feet, and that might be even someone who is pregnant. It doesn't necessarily have to be somebody who is older. And then some of them have heat and massage, and then ultimately, if you can't get yourself up out of the chair, it'll lift you up so that you can then proceed on with your day.
You are basically giving people hope and opportunities that maybe otherwise wouldn't be there.
Correct. And there's nothing better than having someone come in and seeing the smile on their face when they leave here, that they just know that they can be better at whatever they're trying to do for the rest of their lives.
Right. So not only are you and your team able to help people figure out what items might be beneficial for them to purchase, you also offer rentals and you even service these items.
Correct. So anything that you buy from us, we service it. And then even if you didn't buy it from us, we will try to service it. There's certain products that we simply can't get parts for. The products we bring in, we know we can get service and we can get parts. If you're having a rental situation, we rent hospital beds, reclining lift chairs, power wheelchairs, power scooters, kind of whatever you need. And then we also have like the bath safety. So again, if you've had surgery and you need to be able to sit down in your bath or shower, we have equipment that can help you with that as well.
What has the response been like within the community?
We've had a great response with our Try Before You Buy. That's kind of one of our mottos as well. People have loved coming in, and that's often what we hear is like, I've spent hours looking online. I'm so glad you guys exist because now I can try it and actually see what I'm buying.
And for the people that are saying, you know, maybe I could find something in there, but I'm nervous, I don't know if I'm ready to do this, what's your biggest piece of advice for them?
Give us a call. Come on in. We're very welcoming. We're open 10 to 5 Monday through Friday, and we are open 10 to 2 on Saturdays. So if you need to, bring in your mother or father if that's who you're shopping for, or bring in somebody else to come with you even to help you shop.
Rocking Mobility, they keep you rolling. I love that so much. Thank you so much for your time.
Thank you for coming.
When we come back, how the Salvation Army is offering help and support to older adults.
Sponsors of New Day Cleveland include
The Salvation Army West Park Corps has a long history of providing programs for people within the community. And joining me this morning is Major Juanita Stanford. Thank you for allowing us to come into your wonderful abode.
It's an honor to be able to speak about our seniors.
So we're talking about seniors today, and I think it's really important that we know this is such an important demographic that we often overlook. But here at the Salvation Army West Park, you have so many wonderful programs to assist them in their day-to-day lives.
Yes, our senior program really is a highlight program of our center, and we get to see seniors 5 days a week, interact with them in a lot of different variety of ways, and just to be able to have fun and really eliminate that isolation that many seniors face.
So let's talk about some of the goals. Obviously eliminating that isolation, but what are some of the other things that you're working to do for the senior citizens within our community?
Particularly seniors, older adults struggle with continuing to have that cognitive development, and so we provide a lot of activities that help them to strengthen that, remembering back in the day when they had different activities going on, but just to continue to connect with folks so that that isolation is eliminated, as well as to be able to stretch the brains so that they continue to be active mentally.
And I imagine this requires the effort of so many people to be able to do this. Talk about the members of the Salvation Army West Park that are involved, and is this something that volunteers are a part of as well?
Volunteers can be a part of it, yes, to help with just befriending someone who struggles a little bit maybe with their dexterity or their walking, or just needing to have some extra social support. But there are a staff of 3 that actually run our program. We have a director as well as an activities coordinator who helps with all of those activities, and then an additional driver and cook that help with both the in-person congregate program as well as the mobile meals.
This has to be such a rewarding thing for you, knowing you're making an impact on these people's lives. Do you find that you get attached to some of these senior citizens?
Absolutely. All of us as a staff, we really try to wrap our arms around the seniors who participate in our program. So even as they are involved in our day-to-day Monday through Friday program, there are often times we're able to be involved outside of the center in other activities and support them in other avenues of their lives as well.
Do you have any highlights since you've been a part of this program of a moment or memory that sticks out for you?
There are a couple, but one in particular, most recent, we had a married couple who participated in the program, and the wife recently passed away. But it was wonderful to be able to support them through that journey. And the husband in particular, I was able to go to the nursing home and to see her as she was passing away, and just a nice opportunity to be able to wrap our arms around them and support them as a community when you're going through some difficult times.
I'm sure that meant so much to her and to her family as well. For the people that are watching that are saying, you know, I know someone that might be able to take advantage of the programs that you offer, how can they get more information?
Certainly to call our office here at the West Park Salvation Army, and we can connect them with the director, and she will explain more of the ins and outs of the particulars of the program. But there are, in addition to the senior program that happens Monday through Friday, there are a variety of programs that are available to help the whole family from birth to the grave.
Major, thank you so much.
Thank you so much.
Well, that'll do it for our senior show, brought to you by Mutzko Insurance.
You can find a full list of all of the places featured on today's show on our website at boxsafe.com.
I'm David Moss.
I'm Natalie Herbick.
And we'll see you on the next
New Day Cleveland.
So long.